We're just going to take a minute to compare and contrast the sympathetic and parasympathetic division system. We've mentioned before that the sympathetic division is your fight or flight, and your parasympathetic is your rest and digest. So the sympathetic is mostly going to be active during situations where you're fighting or flighting, and your parasympathetic is mostly going to be active during situations where you are resting and digesting. I'm going to start on the right-hand side of this picture because I think that you guys are probably all really closely associated with what happens when you're having an adrenaline rush or a sympathetic response. So we're going to look at what happens with a sympathetic response, and then we're going to compare that to parasympathetic. Almost always, we're going to be opposites with sympathetic versus parasympathetic. So, for example, to begin, if you are having a sympathetic response, you're getting ready to fight or flight. So I like to use the term of running from a bear in the woods. Not that you would run from a bear because that would be dangerous. However, if you were, your sympathetic nervous system would cause your pupils to dilate. That should make sense because when you're running, you want to make sure that you can see well where you're going. So the more light that gets into your eye, the better you can see. On the flip side then, if you are having a parasympathetic response, you can see that your pupils are going to constrict. So less light gets in because less light is needed, mostly. If you're having a sympathetic response, you're going to decrease salivation. So again, as you're running from the bear in the woods, salivation is something that you do in order to eat. And it wouldn't make sense for you to be doing that because you need to focus on things like running. On the flip side, if you're having a parasympathetic response, you can see that your salivation increases, and that's simply because you're getting ready to digest. Back to the right side, under sympathetics. If you're having a sympathetic response, a couple of things are going to happen. You're going to increase your respiration. Start breathing faster so that you can run. Your heart rate increases so you can move more blood around your body. And your blood vessels constrict because constriction of the blood vessels is going to increase blood pressure. If you look at those same things on the opposite side for parasympathetic, if you're having a parasympathetic response, your respiration rate decreases, your heart rate decreases, and your blood vessels dilate in order to decrease your blood pressure. Now, if we look at the sympathetics again for digestion, if you're running from a bear in the woods again, you don't care if you're digesting your food, most likely, and as a result, you're going to inhibit your digestion in the stomach, you're going to inhibit your digestion in the intestines as well. However, looking over on to the left side for parasympathetics, if you're having a parasympathetic response, you stimulate digestive processes, you also stimulate the stomach and your intestines. Now, back to the right side. If you're having a sympathetic response, your urinary bladder is going to relax. Again, it's not important that you void as you're running from the bear in the woods. This is always that question that people say, but when you get nervous and you have a sympathetic response, you feel like you need to go to the bathroom. Here's the reasoning behind that. As your bladder muscle relaxes, it stretches the urinary bladder. Stretch is the stimulus to go to the bathroom. So it does in fact relax as a result of a sympathetic response. It just starts another reflex in your body, which is called micturition. So not only does your urinary bladder relax, your kidneys are going to not produce as much urine, and we're also going to inhibit defecation. So same thing there. The urinary and the, I guess for the most part, your colon are going to be inhibited. On the parasympathetic side, if you are having a parasympathetic impulse, your bladder is going to contract, which again is going to cause you to feel the urge to go to the bathroom. And then we're going to also stimulate defecation. The one thing that I want to touch on here is that if you've ever been to a public restroom and had to urinate, let's say, you need a parasympathetic response to initiate urination and to initiate defecation. So sometimes we get what we call stage fright. Go into a public bathroom, you have to go to the bathroom really, really bad. It's very full. You get in there, you get ready to go to the bathroom, and all of a sudden you can't go. That's because you have that nervous, there's lots of people in here, they're going to hear me type of response, which is sympathetic. That inhibits, you see, both urination and defecation. So it's going to take you a minute to get over that little rush of sympathetic impulses and have the parasympathetics kick in so that you can, in fact, have a bowel movement, let's say, or void your bladder. Either way, I'd like you to know that what happens during a sympathetic response and what happens during a parasympathetic response. I also want to urge that sympathetics are not always excitatory and parasympathetics are not always inhibitory. It's just how they affect a certain system at that time.